Now I want to invite Mr. Kapil Gautam. Mr. Kapil Gautam is an optometrist by profession. He's our next speaking delegate, and he is the founder of Mero Eye Foundation and also the chairperson of the conference AOE 2021. He is a former president at NOSS. So, hello, Kapil.
Yes, I can hear you. Can you hear me?
Yeah, I can hear you.
Thank you so much.
Okay, so over to you. You can see your PPT.
Thank you. Okay. First of all, I'd like to thank Dr. Drake. Thank you so much, Doctor, for your time. It was always it's always be pleasure to hear from you. And let me check my slide. All right. So can you see it, Monica?
Yeah, I can see it right now.
All right.
Yeah. Okay.
Thank you.
You can continue.
All right. Thank you. So my topic for today's presentation is comparison macular ganglion cell complex and the peripapillary retinal nerve fiber in the glaucoma. So I just want to go through the brief introduction first, like what do you think if I say the glaucoma, or what do you think about, if I say the diagnosis for the glaucoma? I think it's obviously come your mind in the two different ways. The first one is you will be thinking anterior eye examination, that's from the slit lamp or other techniques, and another is a perimetry, and another is posterior retinal examination, most probably the optic disc. So what if we are unable to examine? This is the conventional way that we do the measure of the posterior fundus optic nerve head, right? So what if we could not measure the posterior pole optic nerve head, and if we think to examine the other parts from the posterior segment? So most probably we didn't have answer for that. So this is the study that shows that if we can't directly measure the peripapillary retinal nerve fiber layer, then we can go to the ganglion cell complex, right? So this is the very clear that macula, this is the area of macula, and the ganglion cells. I will go briefly about the introduction and everything about the ganglion cells. All right, Monica, I'm clear and louder, right? So you can hear me well.
Yes, I can hear you.
Okay. Thank you for confirmation. Let's go. All right, so you can see the screen on my right side. There is a picture of ganglion cells. This is the POAG case, primary open angle glaucoma. In my left hand side, there is a ganglion cell with the normal subjects, right? So just go with the thickness, the side. If you say that there is a green and a blue light, there is a high, you can see the thickness over there in the left side where the POAG, this is the thinning. So this is a very basic information that when you have got the pressure, when you have got the pressure on your eyes, it automatically thin the posterior segment. This is the basic concept. So I'm going to more about on the next slide. So what is then the ganglion cell complex, and why people are more interested to study on ganglion cells? I have also seen that there is, besides the glaucoma, it's been research in myopia and other particular subspecialty areas. But my interest, from my point, in the ganglion cells, if we are very familiar with the 10 layers of retinas, and if we see the first layer from the inner plex from side, and nucleus as a ganglion cell layers, and the inner plexum layer as a axons. So this is the complete, if you imagine neuron cells, so this is the one complete cells from the dendrites, nucleus to the axon. That's how it's directed towards the optic nerve. Well, so this is the brief introduction about the ganglion cell complex. Then why we should study, or how it's indicated in the glaucoma. So in the different stages of glaucoma, I mean, in the first case, if there is nothing suspect of glaucoma, and there is normal thinning either in the retinal fiber layer in the macular ganglion cells. And after the patient suspect with the glaucoma, it's in the first stages, there is seems change on the ganglion cells. So basically, it's seen in the macular area around the area of 3 millimeter to the 6 millimeter, and then after it will see in the retinal fiber layer. So there is the stage. So some of the interested candidate might have queries like what is the duration between the ganglion cell complex and the retinal fiber layer. So it's depend upon the severity of the glaucoma. Might have maybe we can study later on other studies, but basically it's depend upon the how severe and pathogenic is the glaucoma. Right. So this is the picture that I just want to show how it seems if we do the retinal nerve fiber layer and the in the peripapillary retinal nerve fiber layer. So this is the normal picture that it shows the what is the average and what it the value should be in the normal population, and it's a left eye peripapillary retinal nerve fiber layer image. This is the normal image, and here is the point that I want to discuss. It's exactly different from my hands, and in the picture in your screen, in the right, in my left, and in your right, there is the picture of the right image, and on the left side there is the picture of left image. If you see, this is the completely diagnosed POAG from the glaucoma specialist. Even you can see the difference between the two pictures. Either in the left eye, you can see, even it is diagnosed as the primary open angle glaucoma, still you can see the difference. I mean, this is the normal value, right? So it's a given indicate that it's the normal, it's showing the normal. Even the patient is diagnosed as a primary open angle glaucoma. So here is the big question. So how we can trust the peripapillary retinal nerve fiber layer to diagnose the POAG? So here is the big question. So for that, I'll be talking all this the result and conclusion on later on slide. But before that, I would like to go through the such introduction of my study. You can see the what is by my normal patients are enrolled in my study, and what is the mean of the age. And this is the objectives. I have already clearly said that this is the only comparison between the every 3 subjects. We have 3 subjects with including the normal individuals, glaucoma suspect, and the POAG. And if we compare the 3 different group on the 3 different retinal nerve fiber layers and the 3 different in the 3 different subjects on macular ganglion cell complex. So this is the hospital-based study and cross-sectional study. So these were the instrument I use to examine the patient or to do my research. Here is the test that I use and my prevalence value for the to be significant. All right. So here is the box plot. It's just showing that the mean deviation. Like I'm comparing these 3 different group, and it should be diagnosed, right? So what I did is every patient, it should be already confirmed that it's a glaucoma suspect and that it's a POAG or having a glaucomatic patient. So these were the tests that we take from the perimetry. So this is the right eye, and this is the left eye. Again, there you can see the variation in the mean deviation. And here is the double hum chart from the retinal nerve fiber layer. If we compare, we compare every 3 different group in the full quadrant with a overall average. So this is the figure. You can see that the control group is determined by the regular line, and the double dot line is representing for the POAG. If we compare these two different groups, still we are lagging on the nasal side, and it's a giving a false result, right? So this is the right eye double hump picture, and this is the left eye. Again, this is coincide in the nasal side, and POG overall in the overall patient, it seems the on the temporal side giving a false result with the coinciding on the nasal point. So this is the study. This is the graph that representing from the macular ganglion cell, and my objective here to have a presentation. So here is a uh, demarcation. Here is the difference at the second point. There can be a relatively thinning or clinically significant in the POAG pattern than the normal pattern. So again, this is the on the left eye, where it's a comprehensive difference between the POAG and the normal difference. So here is the discussion. So macular ganglion cell thinning was significantly more in all the quadrants in the retina on the glaucoma subfield and the POAG comparing the concept. So what is my conclusion here? All right. So okay. My conclusion is if we measure the macular ganglion cell is significantly less in all the parts of the retina in the cells such as the retinal peripapillary retinal fiber layer in the POAG and glaucoma subfield. In macular ganglion cells can be used to complement the test for the peripapillary retinal fiber. And macular ganglion cells found they have higher capability for the diagnosis of the glaucoma and better correlation the peripapillary retinal fiber. And the ability to diagnose POAG with the ganglion, macular ganglion cell thickness is comparable to the peripapillary retinal fiber to get all good possibility to the peripapillary retinal fiber. Thank you so much. These are my references. Thank you so much. If you have any queries, you can still kindly drop in the comment section. So, Monica, over to you.
Thank you, Kapilji. It was indeed a great presentation. Hello, can you hear me?
Yes, yes, I can hear you.
Okay. Thank you, Kapilji. Thank you for such informative session. Also, I would like to thank all the participants for the patience as well. I'm really overwhelmed by the amount of information I'm able to receive through these sessions, and so is the audience. So we have come at the end of this session. So before ending this session, would like to thank all our delegates and all the attendees on behalf of organizing committee of AOE. So thank you everyone.